Hello, my friends. Today we have on the show Dr. Ambra Brown, and she is a nurturing, hardworking, and caring mom of one who has dedicated over 15 years as a doctor of physical therapy. Through her own experience from planning to conceive via an IUI to navigating the challenges of pregnancy, she now helps others become empowered and healthy during preconception and throughout pregnancy. I'm really excited to have Dr. Ambra on the show today. We are going to talk about all things getting a positive pregnancy test, and then now what? What do we do next? For so many of us, there is a big hill and it's a big feat to actually get pregnant. And so now that we are pregnant, I thought it was necessary to bring on Dr. Ambra onto the show. We're going to talk about lots of stuff to think about, plant seeds now, so that this is not all overwhelming and news to you when you do get pregnant. So without further ado, welcome, Ambra. How are you doing today?
I'm well. Thank you for having me. I'm really excited to be here. Thank you.
Yes, my pleasure. So before we get into the meat and bones of the podcast, I always like to ask my guests how they came into this space. So if you're open to sharing your story, we'd love to hear.
Absolutely. So I'm going to try to keep this short, but there are so many things that has happened. But as you mentioned, I am a physical therapist by trade. So for me, I've always believed in just health, overall health, and helping people know about their bodies and how to heal and just about overall wellness. So I knew that I always wanted to be a mom. That was something that I just knew in my heart. And for a while, thinking that I was going to get married and it was just going to happen all so naturally, and marriage didn't come, but that's okay. I'm fine with that. I'm at peace with that, and who knows what'll happen with that. But I knew what's the next step, like what's going to happen. Like, so I chose to be a single mom by choice, and that was just going through what was the process of going through a sperm bank and then looking into the best fertility clinic for me to do IUI. And with all that being said, I knew from my past, supposedly I had PCOS, so I didn't have a regular menstrual cycle. Don't really know if truly I was actually having PCOS because my fertility doctor inspected me and she didn't show really signs of that nature.
Mhm.
But either way, I knew I wasn't having a regular menstrual cycle. So we just kind of went through the process of just actually getting that taken care of. And during that time, I knew I needed to prepare my body for the fertility process. So just going in and based on my healthcare experience, just kind of figured out how to go about just eating better and understanding like the food and just preparing my body for that. So once that kind of happened, I did go through IUI, and first try went very well. Well, actually, first try didn't go so well, which is hard as a single person because you don't really
Mhm.
have the support that you need. So, but I was okay. But the second trial went really well, got pregnant, and that was just a whole nother thing. I didn't really know what pregnancy really meant, and just going through the trials and tribulations of that and by myself. I had some support, but really just by myself, and not knowing what a doula meant, not knowing, you know, how to really prepare for labor and my options, and just not understanding everything. Really, I did not know that until after, but I wound up having a really traumatic birthing experience where I just at the end, I'm just very traumatic. I won't go too in depth with that, but it was just something that caused me to have PTSD from labor and then also postpartum depression and going into the whole breastfeeding issue as well, not knowing what that really entailed and how challenging that was. So having all of that, I knew that from here on, I wanted to help people be more aware be their own advocate, understand the whole process of pregnancy. And because I had, experience as a healthcare professional for 15 years, if I was struggling, then surely other people were struggling. And I just knew that somewhere along the way, I wanted to help women. And so, yeah, I became a certified pregnancy health coach, which, interestingly enough, when I first came out of school, undergraduate school, I wanted to actually be an OBGYN, but actually decided to not do that part. But I did get my doctor's degree in physical therapy, and then fast forward to actually now having my certification in pregnancy. So it all kind of worked out together. But I'm using like my expertise in the healthcare realm as well as my personal experience to be able to coach women on just being well aware, having being an advocate for yourself and understanding the process to the best of their ability when preparing for pregnancy and during pregnancy. So that's just a little of a nutshell of how it came to be.
I love it. Thank you for sharing. Yeah. I honestly, every person that I speak to, or not, every guest, majority of the guests that I've had on this podcast so far, and majority of the practitioners that I connect with in this space, and including myself, all have their own personal story and how they came into being this practitioner. So it's so fun to, I guess for me, it's fun to hear. It's fun to hear other people's journeys. It's because it's that this work that we're doing really comes from like this deep rooted, passionate place. So we all are lovers in this field, and it's a wonderful thing. It's a wonderful thing, and there's more of us coming out. This topic is being much more widespread, well known. And it's exciting because at the end of the day, my mission too is to just empower women and couples how to understand their bodies, optimize fertility, and advocate for themselves, because we live in a medical system that unfortunately doesn't really give us the tools and the opportunities to do that for ourselves. So, okay. So with that said, let's start with the first question I would have is, so we know that, getting pregnant can be challenging, and you've got all of these things in your mind that you're thinking about with what supplements to take, the foods to eat, understanding your fertile window, cycle charting, if that's what you're doing, getting your partner on board with optimizing his sperm parameters. There's a lot to think about. And so the challenges don't necessarily end once you do get pregnant, because we have all these fears and anxieties for getting pregnant. And now all of a sudden we are pregnant. And now a whole new set of fears start to creep in, right? How I'm a certain age. This means that I am more prone to having miscarriages, or I've had a miscarriage in the past. So you have this kind of post-traumatic stress disorder from that happening in the past. What do you eat? You don't want to eat the wrong foods. Like this whole new set of fears start creeping in. So I'd love to hear from you. You get a positive pregnancy test. Okay, so now what? What would you say are like the top 5 things people should start thinking about before they even get pregnant? Because that is the ultimate goal, and that's what they're preparing to do, and that's what they're striving for cycle after cycle, month after month. And so if we can kind of equip them with some of that knowledge and some of those tools, when that time does come, perhaps we can quell or ease some of that anxiety, and give them a little bit of a roadmap so that they can say, okay, you know what? I remember I heard Dr. Ambra telling me I need to find an X, Y, Z, whatever it might be. So I'll throw it over to you, and I'm excited to hear what you have to say.
Absolutely. So this is like not like it's 5, but there's so much more that I dive into. But the ones that I think that most people don't even think about is, one of them is really finding the right OB. So interviewing your OB. Some people think that if you have a conjunction, an OB and a gynecologist, so you have your gynecologist and she's also your OB, you don't have to keep your same one. So like, you don't have to see your gynecologist and then transition to her or him as an obstetrician, That's not necessary. You can always find someone else. I say this because some doctors have different views compared to what you value or cherish or think about. And so you want to know, looking at their C-section rate, looking at what they believe. Do they believe in, if the baby is supposedly too big, they would want to kind of push you into having a C-section? What is the mortality rate on their end? Do they believe in you having a doula come in with you? There's so many things that you want to ask your obstetrician so that you can understand what they believe. And so if it does not match up, then you have the right to find someone else that believes in your values and can support you and not pressure you. So it's really important to definitely interview as many as you need to, so that you can feel comfortable in the process of your pregnancy and during the actual birthing experience. So that's something that I really, first and foremost, believe in, because if they don't value that, or they don't respect that, then it's going to be challenging, and you're going to, feel unsure of yourself and question yourself and make you feel like you don't know. And that will just be a hard process because you're already going through the pregnancy, and that's a lot in itself. So having someone tell you and not give you the opportunity to express how you feel, validate you, and explain things through this whole process would make it hard. So finding someone that supports you and that you're on the same page. So that's
number one. That's awesome.
Yeah.
So if somebody has an OB, like I'm just thinking of myself as an example. So right now I don't have an OBGYN. I just kind of have my primary care physician, and then I have who I never see pretty much ever. And then I have my naturopathic doctor that I go to if and when I feel I'm in need of something. So somebody might not even have any OBs before they even get pregnant. And they're like, oh, I'm pregnant. I need to go find an OB. And then, like you said, these are the questions that they should be asking. What's your C-section rate? What's the mortality rate? And are you open to doulas? Do you have any other kind of main questions that you would say these are like big things to ask for or look out for?
Absolutely. So the other ones would be just like, if you haven't started your prenatal vitamins, like really asking them which ones are good. Sometimes they don't really know.
Yeah.
but but still asking. And then like the dosage of what you need, what you're taking. Always for me, asking to get like blood work done, because sometimes you're missing something. Maybe your iron is low. Maybe you don't need, a prenatal vitamin that has iron. Maybe your iron is good. Making sure that you're not anemic. I mean, just making sure that your blood work looks good, and making sure that if you are a high risk pregnancy because of the age, or maybe you were pregnant before and you had preeclampsia, just making sure that they're on the same page and that they're really going to monitor you, and not just make sure that you're just some other person, like you're an individual person, and that that they are okay with you asking for a certain lab workup. That's really important to me, for sure, so that they know, and not just kind of guessing, and they can have the real values and adjust accordingly with whatever you're going through during the pregnancy.
Okay, I like that. Yeah, that's great. And if somebody does decide to go look for an OB before they even get pregnant and they're not pregnant yet, these are still questions. Like if you know that next year you want to get pregnant, but you still need to work with an OBGYN, and you maybe already have one because it's past things, or you're looking to get one before you even get pregnant, just because you're not pregnant yet, I want to mention that it's still okay to ask all of these questions, because this is the plan for you in the future. So don't think you have to wait to get pregnant before you can ask these questions. I think it's important to also share that, regardless of where you are on the journey, not pregnant or just newly pregnant, when you're assessing, ask these questions up front. So that's a great suggestion. So what would you say is tip number 2?
Absolutely. So I know this may sound silly, it may not, but I think it's important to realize that generally, when you find out that you are pregnant, even probably before, but generally when you're pregnant, usually the first trimester can be challenging about how you're feeling, tired, fatigued. I mean, it's a lot happening to your body at once. It's a new thing happening to your body. Your body is trying to adjust and just figure out how to accommodate this new wonderful being inside of you. And so if you are working, if you already have children, if you're married, whatever the case may be, just in general, you probably are just tired anyway. And to figure out what to actually eat on top of being going through these sensations and feeling nauseous and sick. And, it's important to meal prep, like really take time before pregnancy, if you're trying, to just think about the foods that are easy to make and have them stored in your freezer for the first 3 months or so, so that you can just pull out something and it's just warming it up or putting it in a crock pot and like being ready to just, that's done. You don't have to worry about it, think about it. And if you're not even hungry and your family is, then they're taken care of, and you can sip on whatever you can actually tolerate, that
Yes.
takes one thing off of your plate. And if you're not that kind of person that likes to meal prep, maybe this is where the support system comes in and you have like friends and family go ahead and help you prep, or even like there's a lot of companies now
There's
that you
companies.
can
Yeah.
apps like Hello, I don't, I'm not part of these people, but I don't affiliate
Yes.
with them. Um, but there's different ones that kind of just pre-package these things for you and you just have them and you can put them in the freezer and they're there. So there's plenty of things that you can do to set yourself up for success as far as prepping and being prepared as far as what to eat, while you're going through this journey, this definitely this this change that's happening. So meal prepping is really important. I think most people don't think about that until it's already here, and then you're like, "Ooh, I just feel terrible, and I don't really feel like cooking. I don't know what to cook," and that's added stress that you don't need.
Hmm. That's one thing I see a lot with my clients who I take through my one-on-one program. And they always say to me, I am so grateful that I learned how to properly eat for myself, balance my blood sugar, know how much protein I need to get in, and have the resources and tools up front before they got pregnant. Because once they got pregnant, like over 50% of my clients feel all of those first trimester symptoms. And they're like, Nora, I can't, like, all I can eat is a piece of pizza or like a bagel with cheese and butter. Like, I cannot stomach anything else, no matter how much I try. So it's cultivating those skills prior to getting pregnant. Like you said, I remember I had a couple clients texting me because I would help them with the meal prepping. And I say, they're like, please tell all your other clients that they need to learn how to meal prep before they have a baby, because this is just, it could be a learning curve for somebody, especially if this is not something that you're used to. But if they're listening to this podcast, they will hear it until the cows come home, because I say it all the time about stabilizing and balancing your blood sugar, getting in enough protein, eating balanced meals. So hopefully, this is ingrained in their heads. And coming from, again, more practitioners that I'm interviewing in this space, it's such an important, simple, yet can be complicated depending on how you look at it, task that really makes such a difference as you do it. And I loved how you even said, even if you meal prep and you've got a partner and maybe you already have a child and you can't eat it because, again, if they feel sick or icky and it's just not going to go down and stay down, then you already have it in your fridge for your family and you don't have to think about that too. So that was a nice little added bonus. What do you recommend for your clients when they're in the first trimester and feel really nauseous? And, it's hard for them to kind of eat that quote unquote clean, healthy diet. Like, do you have a special drink or go-to tea or something that you
Yeah.
recommend for them?
Actually, I just had a client who reached out to me because she's newly pregnant, second child, but every child, every pregnancy is different, right? Like their
Yes.
first child, they were fine. This one, she reached out, was like, "Oh my God, I feel so terrible, can't stomach anything," and that's okay. Like I said, like do the best that you can, because if you
Yes.
have prepped your body before,
Yes.
then you have the appropriate nutrients that your baby is going to be just fine. But I just do what you can. Like for me, my go-to are smoothies. Like
Yes.
just like packing in the fruits and veggies and adding your proteins, like or even like your chia seeds, your flax seeds, whatever that's going to be really nutrient for like your body. Packing that into a smoothie and sipping it along the way. You can
Mm,
do like I love ginger, so ginger tea,
mm,
peppermint tea. Um, I mean, if it has to be some toast, maybe you can tolerate a little bit of toast and like smooth peanut butter, like that smooth, creamy one. Sometimes the chunky can offset people. So just the texture. So just
yes.
doing that. And then always for me, I just still suggest having that acupuncture wristband is definitely helpful
Mm,
too. But just nibbling what you can along the way until you start to feel better. And I do mention too, um, at night, like, having like something like a piece of toast or crackers at night when you wake up, you can kind of nibble on that. That kind of eases your tummy before you officially
mhm.
wake up. And one thing I did find, and you may have mentioned that too, I don't know, but when you wake up, sometimes people get sick after they brush their teeth. So
Mhm.
sometimes toothpaste can be an aversion. So maybe just switching up the toothpaste, it keeps you from being sick, or really rinsing out your mouth really well. So things like that, that I have suggested to kind of help them to ease the morning sickness, but just really doing what you can for the meantime, until it kind of settles down.
Hmm. Exactly. Nobody knows until they get there. And it's so funny
Mhm.
when working with clients, sometimes people have the most like weird aversions, or like they're like, I loved this food before, but now just the smell of it drives me mental. So it's kind of this unknown journey, like this unknown period of like, well, how is my body going to respond to all of this? So
Mhm.
yeah, great. I love some of those suggestions. All right. What about tip number 3?
Yes. So this is a big thing for me, and I will share a quick personal experience. And that's the third one is like finding a lactation specialist before before you're pregnant. But if you are
Yes.
pregnant, book someone now
Yes.
because it will help you. For me, I didn't know anything about a lactation specialist. I mean, I knew that there was one, but had no idea what that all entailed
Mhm.
until I was actually, when I gave birth to my son, and they laid him on my chest, and they were telling me about just how to prepare, how to position, the baby in your body. And I was tired. Like I had no idea just from laboring for, gosh, over like 12 hours. I don't know how long it was, like 20, 12 hours. I don't know. It was just a long process.
Yeah.
It was definitely unmedicated. But anyway, I didn't remember anything this lady was telling me. I'm just like, I'm tired. I have this person on my chest, and I'm excited, but I'm exhausted. So you are telling me about breastfeeding, and I'm thinking I'm hearing it correctly, and I'm thinking that I'm doing it correctly. And it was going well when I was at the hospital. Towards the very end, the last day, I noticed that my son was not, I felt like he wasn't getting enough milk.
Mm.
And I kept asking the lactation nurse, and she said I was doing it right, but I didn't feel like it was. So when I brought him home, it was definitely a challenge. I felt like he was crying a lot. I couldn't figure out what it was. I didn't know if he was getting enough milk. And he's only taking one side, like one breast. And
Mm.
it was just kind of hard. And calling the hotline to figure it out was challenging too. And so I just didn't know what was happening. I didn't know what was going on. So it really just stressed me out. So when you're stressed out, you're not producing the milk because you're stressed, and then your
Mhm.
baby stressed. So all this was just happening. And so a great friend of mine, she realized I was struggling and had found a lactation specialist for me. And we went to like, I think like a day or two later. And when I went, she was beautiful. Like she calmed me down and said, "You're actually doing things right as far as he's getting enough to eat. Um, he doesn't need that much because his tummy is tiny, you
Still so
know."
tiny. Yeah.
Yeah. And so, but she like just reassured me, showed me different positions to like, hold the baby and how I could feel comfortable in the positions. Just so many techniques that helped me. And literally, I felt so good that I nursed him for almost 2 years. It was like night and day.
Wow.
But I feel like, waiting until after the baby is born is personally too late because it's a lot happening. And I feel like if you
Mhm.
can prepare yourself before and hire a lactation specialist, and you can always, again, interview, and you don't have to just do the first one,
Mhm.
interview to make sure you're on the same page, that you understand. And I think now they even come to your home, and there's mobile lactation specialists,
Mhm.
nurses that come to your home. If you don't feel like getting out, you can go to them, you can do it online. There's so many opportunities, but either way, having them available to show you these techniques before, so that way you come in feeling good and confident about it. And then when you are breastfeeding at the hospital, at home, you feel good and you can check up with your specialist to make sure
Mhm.
everything's going well. Um,
Mhm.
so I really think that's really, really important. And it saves you from feeling like you're less than or you're incompetent, because I felt that way. I felt
Mhm.
like I was not doing well, and I was like, maybe I should go into formula, because it's not working. And so it's just finding the right person to help you be prepared and feel good about coming into this beautiful experience that it can be for you and your baby.
I love that. And I want to share a personal story with my sister-in-law because she recently had a baby. I was a first-time auntie this year, which, or I guess when this is coming out, it'll be last year. But it was super exciting. But I'll say this is like a perfect example of my brother and his wife not having a lactation consultant prior to giving birth. She gives birth and the birth was fine. She comes home and the baby is not latching properly. And so obviously, like, time is of the essence when they're in such this brand new state. These babies have to feed. You can't wait 2 weeks to find a specialist, and you don't know if like these are critical moments when that baby has
Mhm.
just come out and they need to feed. And so they were, my brother and his and my sister-in-law were adamant about breastfeeding. How could they not be? I just drill into their heads everything about gut health. And so what ended up happening was my little niece Angela was tongue tied.
Mhm.
And so they realized she wasn't latching. So I'll tell you, it was like mission, we call it the mission LC, lactation consultant. That's what we call it here in Canada, lactation consultants. And thankfully, I've got a wonderful group of girlfriends still from high school. There's like 12 of us on a group chat. We all stay in touch. Most of my friends have had babies, multiple babies. And I was texting, it was like, all right, everybody, who knows a lactation consultant? And it was like lactation consultants flying left, right, and center, telling my brother, he's contacting all of them, reaching them. They were so lucky that within under 48 hours, they found the right lactation consultant. They got Angela to a certain specialist that had to snip her tongue tie. But the process, my poor sister in law, what she had to go through and the amount of pumping and the soreness of her nipples, and it was on the highest strength because she was trying to get the most milk. It was it was a big thing that lasted for a few weeks until they really got into the groove of it. But I'll tell you, I remember them saying, because I'm very close with them, them sharing that the lactation consultant was like a godsend and
Mhm.
made the world of a difference because they're stressed as new parents. So you don't know, like this tongue tie, you don't even think, oh, my baby's going to have a tongue tie. And so there could be little things that we just don't know about that happens. And so I love this point. Definitely look for a lactation consultant
Mhm.
while you're pregnant do your interviews. You might not even need them, right? Like who knows, but have them set up on hand. So that's a great one, Ambra. Love that
Yeah.
one.
Yes.
Um, what's the next one?
Yeah, so number 4, and I'm going to put on my physical therapy hat for just a moment. This is something that as a physical therapist, I knew existed, but didn't think much about it too much until after my pregnancy, so postpartum. But it's investing in a pelvic floor therapist. It's
Yes.
so helpful beyond belief. You won't, I mean, it's really, really helpful. So, I think you should look into that during pregnancy because there's so much changes in your body. Again, your body's expanding and growing, your baby's growing, your uterus is expanding. And we talk about a hormone called relaxin, which is a reproductive hormone that it's produced by your uterus and your placenta, and it allows your ligaments and your muscles to just and your joints to really relax, allow for the expansion of your baby, allow for the growth, and allow for the process of birth. And so when that happens, things become very painful, loose, and can be out of whack. And you think of like your pelvis as like a basket or a bowl that has like muscles weaved into it, and they just become relaxed and weak. And so that leads to like incontinence, whether it's fecal or urinary, which is, I know it's tough to hear maybe, but that's what happens. It could lead to round ligament pain, or they call it lightning crotch pain. And
Lightning crotch. So is that like sharp
yeah,
pains down right through
yes,
like your vagina into your,
yes,
yeah.
because that ligament attached to the uterus to tether it down to going through the growing, the inguinal canal, or the growing, and attaches to like the labia. So when that's stretched out, you feel growing pain or abdominal pains because of the way that it's inserted and where it originates. So yeah, so that's a big deal. Sciatica occurs, so
Yes.
just basically just nerve pain because the baby's pressing up against the sciatic nerve, so you're having pain in your back. It could be all the way down to your thighs and feet, wherever it goes, as well as just constipation.
Yes.
And even if you are still sexually active when you're pregnant, you could also have pain during that time. So a pelvic floor therapist really comes in and helps you to be knowledgeable, teaches you tools and techniques to strengthen your muscles. They help you with looking into proper positionings and how to breathe appropriately during labor to prevent perineal tears, massaging to help relax the area, and also just making sure that you have the strength in order to make sure you do not have or prevent urinary incontinence or fecal incontinence. So all of these things are good during pregnancy and definitely postpartum. So getting that together will be a lifesaver and release so much pain and stress throughout the pregnancy and on to postpartum. So being educated now and knowing the tools and exercises and training will definitely help you in the long run if you go ahead and start looking into that as well.
Yeah, I've got a lot of my clients when they get pregnant, it's one of the first things I recommend, right? Like even before lactation consultant, because I guess, I mean, for pregnancy, you're usually going through 9 months of pregnancy. Maybe think about the lactation consultant kind of closer towards maybe a few months prior to delivering, or starting to just dabble into asking people around, finding referrals within towards the end of your first trimester. But I would even say the pelvic floor therapist, like as soon as you know you're pregnant. I have had a client and she's dealing with a lot of incontinence, and she's only still just moving towards the end of her first trimester. So it can happen quite early. And especially if you already if you have pre-existing back pain, if you have pre-existing hip, I don't know, issues, pain, whatever it might be, It's a really good tool to have and use. It's I say a lot, or the saying, it takes a village to raise a child. Well, it also takes a village to create a child. If you
Absolutely.
think about all of these different specialists, and I call it the fertility committee, right? Everybody kind of has their fertility committee, and whether it's a preconception health coach like myself, or a physical therapist like yourself, your acupuncturist, your OBGYN, your fertility doctor, if you're at the fertility clinic, there's a lot of people that need to be involved. So I think it's important. I love these two, the lactation consultant and pelvic floor therapist. Just think about how these can be super beneficial to you. And just have them in your back pocket. So again, when that time does come that you're pregnant, you've got your resources and you know where to go. So that's pelvic floor therapist. So is that a lot of the work you do? Do you work with clients doing pelvic floor therapy work?
Actually, I do not. I do general, so I can do general basic exercises for you and teach you like the breathing techniques. But I like to refer out to wherever like that person's living. Like I have a lot of people that live in different parts of like the country, and so I will refer out and say, hey, you should go and see, because I like them to kind of do in person, hands on,
Yes.
so they can kind of palpate and feel what's happening and have a more connection that way, so they can
Mm-hmm.
get the right program for them that's unique for them. So I usually just, if it's something that's not that serious, then I do give some of that general exercises. But yeah, if it's just deeper, I like to kind of refer so they can get a
Mm-hmm.
better examination and make sure, everything's okay.
Mm-hmm.
Yeah.
Awesome. And so what would be the last one? And I know you said you
Yeah.
have more than five, but we'll
Yeah.
we'll we'll cap it at five today.
Yes. Yes. So we've touched on this, and it's truly for me, because it touches so much for me because of going through the traumatic experience of my labor and delivery, and then afterwards with the postpartum depression, which I really didn't know. I actually was going through it until a couple of years later, looking back and realizing I was in depression. But
Mm-hmm.
it's mental health.
Mm-hmm.
It's finding support system to help you with your mental health. And I know with you, I'm sure when it comes to like the fertility coaching, the preconception coaching, I'm sure you talk about just maybe having the mental health aspect, because that's challenging in itself. But even during this process and after pregnancy and after, it's so good to have this. So looking into finding a mental health counselor or a mental health support group, or even like a particular pregnancy counselor that can guide you through all of the that you're experiencing, especially since if you've tried, let's just say you've had the miscarriages, or you've done IUI, IVF, or any of the fertility assistance treatments, and they have kind of failed, and now you're kind of on this hypersensitive
Mm-hmm.
alertness, and you're just kind of thinking about what could happen, what could go wrong. That's a lot to absorb and still be pregnant. So being able to acknowledge your feelings and release those feelings by
Yes.
actually talking to someone about it. And for me as a pregnancy health coach, I go through this with you because I'm part
Mm-hmm.
of your team, but I also refer you to the actual counselor, so that you can kind of dive deeper. But having that, as well as your family, your partner, your friends to be your support system, um, and then if you hire a doula, that's helpful too. And of course, me as a pregnancy health coach, but anybody
Mm-hmm.
that's going to help you, support you in this time, so that you can be able to freely go through these feelings and express yourself, feel validated, feel heard, and find the solutions to help you to um, journey through this process and try to have that positive mindset, as well as a good outlook on this whole process. So I think that's really, really, truly important for your overall health and for the baby, because if you're stressing
Yes.
all the time, you bring that into the womb and your baby feels that. But not just that, it can affect your health and the baby's health. And so you really want to get that under control and be able to release and let go so that you can have the best experience possible and for the future of your baby, because that can pass on and bring that later on in the baby's life as well.
Yes, I love that you mentioned that. I was having a conversation with a friend last night about this whole concept. And I recently watched a movie called The Wisdom of Trauma from a wonderful author named Dr. Gabor Mate. And he talks about how our nervous systems are like set as like a blueprint from when like we're starting in the womb, right? And like if the mom is really stressed and her nervous system is like not regulated properly on hypervigilant mode and constantly stressed, and the hormones that are coursing through her body are going to affect the baby as well. So you could be kind of just setting up your baby with this hypervigilant nervous system and giving it the blueprint that's not going to be optimal for a healthy ideal life, right? Just even going back to the concept of epigenetics, right? That's the environment that we put ourselves in that's really going to dictate our overall health. And so another really incredible, great point. You know, sometimes we think these points are so like these things, so simple. Find my support system, eat balanced meals, make sure I have food in the fridge. Like, you know, like these are things that you hear it a lot. You see it on Google, you see it all over Instagram, but really they make the world, the reason why they're said so much is because they really they can have a profound difference. And a little bit does go a long way too, right? It's not like you have to overall haul your whole life and everything has to do a 180 and that's stressful in and of itself. And you're like, oh my gosh. So I think, these are great top 5 tips to think about, when you get a positive pregnancy test, now what? Write these down somewhere, put them in save this episode, go follow Dr. Ambra, and so you'll have this in your back pocket for when that time does come. So with that said, Ambra, thank you again so much for your time today. Can you let the listeners know where they can find you? We'll put some of this information in the show notes as well, but you could let us know.
Absolutely. So you can find me on Instagram. It's at Dr. Ambra Health Coach. On Instagram, and then you can definitely email me at Ambra, A-M-B-R-A, at Dr. D-R Ambra, A-M-B-R-A, Brown. Or you can find me on my website, which is drambrabrown.com, DRAMBRABROWN.com.
Awesome. So lots of different ways. We'll make sure those links are in the show notes below. And yeah, thank you so much for being on the show today. And we appreciate all of your knowledge and your wisdom and your tips. So thank you, Ambra.
Thank you.